You're watching Baptist Health's Resource Live, where our respected experts bring you timely and practical health and wellness information to improve your family's way of life. We're healthcare that cares. This is Resource Live.
Hi, I'm Janet Kaploon. I'm coming to you live from the Baptist Health Newsroom, and I am delighted to join you here on Facebook for this very important broadcast, because with the new school year comes a lot of stress, a lot of anxiety, a lot of uncertainty, not only for students, but for parents and even teachers. And right now, since we are in the middle of the coronavirus pandemic, we might be experiencing higher than usual levels of uncertainty and stress now that the school year is about to start. So it's very important, it's very timely, and that's why we are bringing to you the experts from Baptist Health South Florida. And we want to invite you to ask your own questions in the comment section below, because at the end of this interview, we will be addressing your questions, so that way you can have the tools and resources to take your stress down a little down, right? Because we're all feeling so uncertain right now. Joining us today to discuss how to manage stress and how to figure out how to deal with it a little bit better and learn how it affects our body are psychotherapist Graciela Jimenez. Welcome. Hi.
Hi, thank you for having me.
And neurologist from the Miami Neuroscience Institute, Dr. Dalia Lorenzo. Welcome, Dr. Lorenzo.
Thank you, Jeanette. Hello, everyone.
Thank you so much for joining us, because I know you're super busy, and I know that just like all the rest of us, you are also dealing with a lot of uncertainty in our everyday lives due to this pandemic, and also because you're seeing more patients. We are experiencing these uncharted waters, and I think that everybody needs a little more help navigating them. So aside from reminding everybody to ask their questions, I want to kick off this segment really addressing that it's normal to feel uncertainty. It's normal to feel that this is leading us to have more stress. And when you have more stress, this can create headaches and migraines. Am I correct, Dr. Lorenzo?
Yes, in the patients that I'm seeing in the outpatient setting, I am seeing a lot of patients coming in with worsening of their existing migraines or with new onset headaches. I'm also seeing a lot of insomnia and even some people who are having some visual symptoms from too much eye strain from being on the computer time and all that. So, yeah.
So do you feel that this is also due to stress and all the uncertainty surrounding back to school as well?
Well, definitely stress is one element that will worsen migraine control. I think the disruption of routines also does a lot to make the sleep poor. So, but definitely stress. The stress, the uncertainty, I think is worsening a lot of people's headaches, anxiety. There's a lot of depression out there now, and a lot of isolation as well.
Which all can even exacerbate those feelings and those symptoms. Now, let's go to the science, right? Because not many of us are aware of what part of the brain is responsible for dealing with stress. Can you talk a little bit about that?
Well, the stress response usually involves three particular areas. There's the what's called the HPA axis, which is the hypothalamus. It's an area in the brain that links up with the pituitary gland, which is the master gland that everyone's heard about, and then the adrenal glands, which are in the abdomen above the kidneys. And so, oops, hang on a second. Sorry about that. You still, do I still have you? Okay. And
Yes.
so basically what happens is that there's an area in the brain, the amygdala, that gets the stress reaction. It gets the information that alerts them to some danger or something, and then that is communicated to the hypothalamus, which then sends a message to the pituitary gland, which then activates the adrenals to produce cortisol. And that steroid, that cortisol, is what's called the stress hormone, and that does a lot of the functions of stress responses. And it works well for short-term stress, but when stress becomes very prolonged and unremitting, then that system fatigues to some extent, and then you can get health repercussions from that. There is an area in the prefrontal cortex, which is in the front here, that functions to try to modulate that whole cycle so that it it doesn't go out of, go haywire. But yeah, those are essentially the sections of the brain and the body that are involved in the stress response.
And what happens with the brain regarding headaches and migraines? What can cause a headache or migraine?
Yeah. So, I mean, there's headaches and then there's migraines, right?
So let's talk a little bit about the difference between both of them.
Right. So, a headache can be caused by so many things. And usually when I have a patient that I'm assessing for headache, usually go through a list of things that could be causing the headache. So first thing, is it eye strain from too much computer time, or the glasses aren't updated? Is it a problem with TMJ, which is a joint disease, temporal mandibular joint disease? It's causing some head pain. Is it a sinus problem and the headache is in the front? Is it a problem with neck disc disease or something that's causing some headache that's going forward? Is it just a standard old tension type headache, which feels like a tight band around the forehead because of muscle tension, prolonged muscle tension? Those are usually the first things that we do. We kind of exclude the more common causes of headaches. But then when you talk about migraine, I mean, migraine is a primary neurologic disorder. It's a problem that starts in the brain with these neurons that fire, and they start a process where the meninges, so which are the coverings on the brain. So actually the brain doesn't hurt, right? You can do neurosurgery on an awake patient after the brain doesn't hurt. What hurts is the meninges, which are the fibrous coverings on the brain. And so a migraine very specifically will trigger neuronal activity that activates the nerves that give the pain sensations to the face and to those meninges. And they also cause the blood vessels to dilate. So it's a very specific neurologic syndrome. And most people who have a migraine will describe a headache that is usually on one side more than the other. Feels like a throbbing, like a heartbeat. It gets worse if you move your head, shake, jump, anything like that. It can be associated with nausea, vomiting, sensitivity to lights and to sounds. It gets better if you sleep. And usually people, after the migraine is over, they have like a migraine hangover, they call it. And then there's some varieties of migraines that come with other symptoms, such as what are called auras. Like some people with migraines will get a warning sign before they get the actual headache. And the warning signs can be anything from, bright flashes. They're called auras. There's usually visual symptoms or some sensory symptoms. So, yeah. So migraine is a very specific type of neurologic headache.
Yes, and it's all very important information, and it all ties in back to stress, which is why I want to ask Graciela Jimenez, a psychotherapist, what is normal regarding stress? A lot of people think that we should all live without stress, but a little stress is normal, correct?
Absolutely. If we didn't have a little stress, we probably wouldn't be able to function. So, so some normalcy, like some things will cause a little bit of stress. So if you're in school, for example, and you have a test coming up, for most people, that might cause a little bit of stress. If you're at work and you have to meet with your boss, you might have a little bit of stress because you're going to meet with your boss, and that always kind of triggers a little stress for somebody. Now, those are little normal kinds of levels. Where it gets out of control and where you start to worry about it is if you then start getting the headaches, when you start getting other physiological responses to the stress. So a little bit of stress is important. It's going to help you do a little bit better on that test. If you have a little bit of stress, you're going to think, I got to study a little bit more. If you have a presentation or you're going to meet with your boss and you have to give them some information, a little bit of stress is going to help you prepare more. If you're going to run a race, a little bit of stress is going to help you prepare ahead of time. Make sure you have the right shoes, make sure you have the right clothing. So a little bit of stress is good for us. But when it gets excessive, when it gets prolonged, is when we have to start to worry.
And right now we are seeing prolonged amounts of stress, and kids are ready to head back to school, whatever that is going to look like for each family, given the options that, depending on the school district, you have been offered, right? So
Right.
I've heard that to decrease stress levels in children, it's really important to start setting up a routine if you don't have one. But how does that connect to mental health?
So kids in general, so humans in general, let me say it like that. Humans in general, we like structure. Even though sometimes we're like, oh, I wish I had a day off to do anything that I want. But we like to know, what time do I get to work every day? What time do I clock out? What does that look like? Where do I sit? What do I wear? Those are things that we like to know ahead of time. Kids are just like that. And actually, kids really thrive in settings where it's structured. So when we have a free-for-all, it might be great on a Saturday, but it's not so great when it's every single day. So kids like that kind of structure. But if you're there, you mentioned that depending on what's available in your district. So there might be an opportunity for you to send them to school. There might be an opportunity for you to keep them home and do virtual learning. So depending on what that is, having a little bit of structure for them is definitely going to decrease their own anxiety, because kids like to know what's going to happen next. So
Yeah.
if you're going to say, we're going to go to the park. Oh yeah, we're going to the park. And what are we going to do when we're going to get to the park? And what are we going to do after the park? And when do we eat? And are we going to get ice cream? Are we going to go play at the neighbor's house? They want to know what comes next. So giving them that information ahead of time, it definitely decreases the unknown for them. And that's really where the anxiety starts to build and fear starts to come in, when they don't know what's going to happen. So giving them some expectations, some things to know, helps decrease that.
So would it help like to establish an eating and a sleep routine and make a calendar or a daily schedule to be able to give them that sense of structure? Like, what would you suggest, given that we're spending so much time at home and that we can't really differentiate between one thing or another sometimes?
Yeah, so I absolutely. And look, for a lot of parents that you're watching out there, a lot of you have been doing this for several months, right? Back in March, when a lot of us went home for the first time from our offices or our schools, we started talking about structure for the kids and what that looks like. But then we had the summer. And for a lot of people, that was completely different in the summer. There was a lot more of that free for all. So if you're easing back into school, it's about having the conversation. So I would definitely sit down and kind of write out for yourself what worked and what didn't work. You as a parent, if you're going to do virtual school, what worked for you and what didn't work for you back in March, April, and May. And so you have that idea and it gives you a nice little structure for it. Then you kind of figure out what the school is asking you to do, because sometimes there's things that the teachers are going to set. There's certain structure that's already being set by the school system. So you want to know what that is. And then I would absolutely highly recommend having a family meeting. Talk about it. Tell your kids what's expected. Tell them what the school's expecting. Tell them what you're expecting, so that they know what to expect. And that decreases not only their anxiety, but it helps decrease any behavioral problems that you'll have, because they know what to expect that's next. And then you talked a little bit about, you said, it's really hard for us because we're at home and it's really hard to differentiate. Where does school start? Where does home start? Where does work start? So having designated areas is really important. And then also having break time. That's incredibly important. A lot of us are tired of the virtual life. We're tired of being on Zoom all the time. It's a lot. And so you have to keep that in mind, making sure you have some breaks in there. And those breaks could include, 5-minute walks. They could be stretching. They could be yoga. They could be jumping jacks. There's a lot of research out there that doing some physical activity, even if it's 5 minutes, actually helps improve cognitive development, helps them retain new information. It helps with their own behavior. It helps with anxiety. So including and weaving in some of that activity really does help.
And at what point would you suggest to a parent to consult a psychologist to get help for a child that might be showing more than usual signs of anxiety or stress? Is there anything in particular that we should be looking out for?
So any changes in behavior. So if your child normally sleeps through the night, and we've had 2 months of no schooling, no nothing, and they've been okay, and then all of a sudden they're having difficulty sleeping, maybe there's a change in how much food they're eating. And when I say, let me go back and say, when I say difficulty sleeping, it could be sleeping too much or too little. It could be waking up in the middle of the night. It could be having nightmares, night terrors. It could be that all of a sudden they're eating more. You've caught them eating more sweets, eating more in general, or not eating at all. Maybe they're even more irritable. Maybe they snap at you, they snap at the dog, they snap at the neighbor, at their brothers or sisters. There's changes in any of those things, then those are times that you definitely should seek out some assistance.
And Dr. Lorenzo, going back to headaches and migraines, headaches can affect children as well, and adults. Obviously, we know I suffered from many headaches, sometimes migraines as well. So I know how debilitating it can be. What should we do if we feel that our symptoms are getting worse?
So headaches, they can get worse temporarily, but definitely there are some headaches that require attention, headaches that are sudden onset, that as if somebody had hit you over the head with a bat. Those are worrisome headaches. Headaches that are, not responding to the treatment that they usually respond to. Headaches that come with any other sort of neurologic symptoms, such as, numbness of one side, weakness, trouble speaking, or changes in, persistent changes in the vision. Those are situations where then it is necessary to seek out attention. Okay.
Okay, that's really important. And to manage stress, because you were mentioning at some point that lack of sleep can also affect headaches and stress, right? How it affects the body. So can breathing techniques maybe help alleviate those symptoms of stress?
Well, breathing exercises definitely do help with stress management. I just wanted to add that when a person is a migraineur, okay, somebody who tends to have migraines, it tends to be an inherited thing, okay? So it usually runs in families. And a migraineur will respond to many things with a migraine. So for example, a migraineur, if they don't sleep enough, if they don't eat when they're supposed to eat, or eat at the right times, or if they take a new medication, many times that'll trigger a migraine. So migraineurs in particular need to learn their triggers and manage their triggers, and that can range from stress. Stress is a big trigger for migraine, to sleep deprivation, to certain foods. Some patients will report that they're sensitive to things like red wine. I mean, we're talking about children here, but chocolate, and other things. But definitely there's triggers that can make migraines poorly controlled.
Okay, and since you're mentioning that there's a hereditary, like a family history factor, then we should also be very aware that if we suffer from migraines, it might be something that we passed on to our kids, correct?
Yes, absolutely. It does run in families. And, if you have a tendency to be a migraineur, I mean, it's just with you all of your life. Sometimes migraines do get better later on, especially in women after menopause. But definitely they do run in families. Yeah.
And Dr. Lorenzo, I have a question for you from a viewer. They're
Okay.
asking if magnesium is a good option for stress relief and migraines.
So magnesium oxide supplements are generally added to a cocktail of medications that are used to manage migraine. They can be useful. Magnesium also has a little bit of a muscle relaxant effect, which also is something that can be helpful. Usually when we're treating migraines, we do a few things. So one thing that we do is we try to give the patient something right at the onset of the migraine, okay? That's what's called an abortive, okay? And that's a pain control, something to try to stop the migraine cold, okay? But when patients start to have frequent migraines, like more than 2 to 3 a month, or a very debilitating migraine that takes them out of work for several days, then we will also put that patient on a second medication that's called a preventative, which is a medicine that's taken every day, not for the purposes of pain relief, but to try to reduce how often the migraine comes on, okay? So it depends on what kind of migraine situation a patient has. Sometimes they can manage it just with abortives. Sometimes they need the abortives, but they also need a preventative. And sometimes things can get a little bit more complicated. But in terms of what to take for the pain when the headache comes, I mean, that can also range from over-the-counter medications to prescription medication like triptan medications. But the important thing with migraines is that when you start to get a migraine type headache, the sooner you get the pain medication on board, the better chance of actually aborting or stopping the migraine in its tracks. So it's better to take it earlier than later.
And I have another question from a viewer for you, Dr. Lorenzo, regarding headaches. You were mentioning that there are some headaches that merit immediate attention.
Yes.
A viewer wants to really know, like, how bad should it feel, or how to know when it's bad enough to consult a neurologist?
Okay, so probably the headache that we most worry about is the headache that is what's called a thunderclap headache. And the other one is obviously a headache that comes with fevers, because then you have to worry about infections and meningitis and that sort of thing. But a thunderclap headache is something that can be associated with an aneurysm or bleeding from an aneurysm. And so that kind of headache, a thunderclap headache, that's the kind of headache that you just go to the emergency room. And like I mentioned earlier, that kind of headache feels like as if somebody came up to you with a bat and just hit you on the head. You know, so it's a very sudden onset, very severe at onset headache. Okay, so yeah, that's one that you just go to the ER. And the other one, obviously, if you're having headaches that won't go away and you've been having fevers or neck stiffness, that's another characteristic of a meningitis. You know, that's another one that has to have immediate attention. And of course, as I mentioned before, a headache, headache that comes with any neurologic symptoms, numbness, tingling, weakness of one side of the body, slurred speech. Those are also headaches that do need attention, immediate attention. Okay.
That's great to know. Now, there's something else that people sometimes have a hard time seeking help, because there's such a huge stigma regarding mental health that if they don't feel that there's like a physical symptom, even though they might be experiencing them, they don't think about asking help to talk to somebody about their stress levels, about their anxiety. Graciela, how do we approach the subject of mental health with somebody that we love that might need that help? Or how do we break this vicious cycle of silence around mental health?
So there's so many different ways to look at this. I think the simplest way is to go up to somebody and just simply say, I'm worried about you. I want to talk to you because there's something that I'm seeing that I'm concerned about. I noticed that you are not, and then insert whatever it is that you're concerned about. Maybe they're not engaging. Maybe they've withdrawn. Maybe they're sleeping more, or maybe they are more irritable, or they're snappy more, right? Maybe they just don't want to talk to anybody, so they're like withdrawn. A lot of that is definitely a sign that something's going on. Some other things that you might notice are things with their sleeping. Maybe their stomach is upset more. Maybe they are complaining of headaches. Maybe they are complaining of, maybe they've gained weight and they're complaining about that. So listening attentively of what changes you might see in them, and then understanding that the easiest way to talk to somebody is to simply say, I'm concerned about you, and I just wanted to bring this up and say, I noticed this, and I'm wondering if that's something that's happening with you. And then also, and the most important thing, especially for parents, is to say, I know that I'm stressed. I know that this is what's happening for me. I know that there are days that I'm sadder than I should be, and it's because I haven't been able to see my family or friends. I know that I have a lot more anxiety because there's a lot more work, and every time I leave my house and I have to put my mask on, and I'm worried about whether or not other people are wearing their mask, whether they're wearing it properly, whether they've washed their hands or not. And those things kind of worry me. So I'm wondering if they worry you. I'm wondering what is worrying, what's going on for you. And so having that kind of setting the tone and being realistic and being honest and saying, this is what I'm experiencing, so I'm wondering what's going on for you, kind of sets the tone and normalizes it, because we're all experiencing something. This is, as we all know, this is global, right? Everybody's experiencing it, and it's ongoing. It's not ending, and it's going to keep going for a little bit longer. One day we won't have to wear a mask, but unfortunately in the next few months we still have to. So having those kind of very honest and realistic conversations kind of helps set that tone.
And is there a resource available for parents to call and to get that help?
So there are some basic things, depending on where you live. South Florida does have what's the 211. So that's a general number that anybody can call. And there you can get different kinds of resources, anything from references for referrals for counseling. There's lots of groups out there that are available. There's different groups available even on Facebook, even on Instagram, where you can connect with other people. Baptist has the Care on Demand app that allows you to contact a counselor as well and get a telehealth session. Your primary care physicians can help you. So those are some different ways. A lot of our teachers are very aware of some of the local resources, and those are ways that you can get some help as well. Does that help?
Yeah, that's very helpful. And we have a promo code for Care on Demand, which is Baptist Health South Florida's app and telehealth app, which I've used, and it helps tremendously. So please take advantage of that. The code is well-being, so use it. So that way you can find the help that you need. And you mentioned teachers. All that we've discussed here applies to teachers and to all the administrators who are also undergoing so much stress. We are not only concerned about parents and students, we are also really, really worried about our teachers who do so much for our children. Dr. Lorenzo, Graciela Jimenez, thank you so much for these answers that have been so, so valuable. Is there anything else that you would like to quickly add?
If I may, I realized that when I was talking about the stress for going back to school, I talked a lot about virtual, and I didn't even touch on the in-person stress. And that's going to be something that I think all parents really need to touch base, at least have a conversation that says, I want to know how you feel about going back to school. Talk about the different protective factors that you and the school are putting in place, and always remind your child that they can't control what other kids do, like if they take off their mask or wash their hands, but they can control what they do. So as long as they're wearing their mask, doing some of that social distancing, but talk about the parameters that the school has. I know all the schools are taking precautions, so ask what they are and share it with your child, and have those open conversations, and that'll get you closer to getting them the kind of peace of mind that they're going to need in order to be able to learn all that information that they're going to get this school year.
And those are great tips also for adults, that we can't control the behavior of others. And by learning how we can take care of ourselves, I think it makes us feel much more empowered. I know we have one last question regarding college students. Really briefly, would you recommend telehealth if we see that a college student is having issues as well?
Absolutely. I think, telehealth has been something that has really saved all of us for so many different things, from primary care to urgent care and also mental health. And it definitely gives us an option. And for college students, it's really important that they get the support that they need. So yes, absolutely.
Well, thank you so, so much again, Graciela, Dr. Lorenzo. I learned so much, and I hope that we have helped parents, teachers, children, anybody who has tuned in to this important Facebook Live have better tools and resources to make better choices for themselves and for their health. Remember that you can connect with us on social media. You can connect with us on Twitter and Facebook, as we're doing right now, but we are everywhere. So please feel free to reach out with all of your questions. We have great programming, and you can also find more information on my blog, hispanaglobal.net. Thank you so, so much. And until next time that we're here with you live from the Baptist Health Newsroom, I'm Janet Kaplun. That's all for today. Thanks so much for tuning in. Bye.
Bye-bye.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Resource Live is brought to you by Baptist Health South Florida. Healthcare that cares.